The dynamic process of wound healing is a great example of how our body's different systems work to repair themselves. So how exactly does your body heal? When you experience a wound on part of your body, it goes through specific and complex stages. This is known as the cascade of healing and is divided into 4 phases: hemostasis, stop the bleeding; inflammatory, swelling; proliferative, tissue regrowth; maturation, scar formation. Phase 1. Hemostasis, stopping the bleeding. When the skin gets injured, the body's first objective is to stop the bleeding. It does this by activating its emergency blood clotting system. Specific blood cells called platelets start to clump together and clot. These clots, which turn into scabs as they dry, also contain a protein called fibrin that forms a net to hold the clot in place. Phase 2. Inflammatory, or swelling. Once the wound stops bleeding, the body's immune system goes into action. The wound area becomes swollen and tender, and there might be some clear fluid on or around the wound. This is the body's way of cleansing the area. During this phase, which lasts from 2 to 5 days, white blood cells are called in to fight infection by eating the dead skin cells and other waste around the area. This prepares the wound bed for growth of new tissue. Phase 3. Proliferative, tissue regrowth. After about 5 days, shiny red granulation tissue fills the wound bed with oxygen-rich red blood cells called fibroblasts to rebuild the area, and broken blood vessels are replaced with new ones. Chemical signals instruct cells in the epidermis, the outer layer of your skin, to create new cells called keratinocytes, as well as other tissues such as collagen to begin the repair process known as epithelialization. As the wound heals, the skin pulls the edges towards the center of the wound, making it smaller. Eventually, it will be covered over with a new layer of skin known as epithelium. Phase 4. Maturation, scar formation. This last phase of wound healing can take up to 2 years to complete. The area may become red, stretched, and shiny as the scab falls off. It may also feel itchy. Scarring occurs because the granulation tissue has grown back differently than the original tissue. Over time, the new tissue gets stronger, and the flawed area will most likely fade or even disappear. Why some wounds don't heal. Sometimes certain factors can slow or even prevent healing entirely. One of the biggest factors is not enough blood supply to the wound. Oxygen and nutrients that new blood carries to a wound are essential to healing. It is estimated that as many as 7 million people in the United States suffer from wounds that do not heal well, known as chronic wounds. Some chronic wounds, like diabetic foot ulcers or leg ulcers, take much longer to heal and are harder to treat. There are treatment options for chronic wounds, such as prescription wound care dressings that help improve and speed up the healing process. Caragel helps wounds heal. Caragel is an advanced wound healing gel available by prescription that is clinically proven to help heal wounds. The active ingredient in Caragel is a form of keratin, a natural substance produced by humans and animals that is critical for regulating wound healing. Keratin sends signals to cells responsible for rebuilding tissue, called keratinocyte cells, to grow and move to close wounds quickly. Ask your doctor if Caragel is right for you, and visit www.caragel.com for full prescribing information and to learn more. Remember, when the right healing environment is put in place, the body works in wondrous ways to heal itself.